Hello everyone, welcome back to the channel. This is Shepherd's Review, and in this video, we're going to be talking about vancomycin. In this video, we'll discuss the usage of vancomycin, the adverse reaction, and things to look out for when giving vancomycin. Before we get started, please like and subscribe to our channel. It'll help with the YouTube algorithm. And having said that, let's get started with the lecture. So vancomycin. Vancomycin was actually founded by a man named Dr. E.C. Cornfield. He's an organic chemist. He founded in 1953 and it was introduced into the market in 1954. Now, vancomycin is a very strong antibiotic. It's commonly used in the hospital as a last resort. Vancomycin is a glycopeptide antibiotic, and the way that this medication is usually given is through the IV. It's because they have reduced intestinal absorption, so it's not really absorbed adequately in the intestinal tract. So that's why they give it through IV. And basically, the way that this medication works is that it binds to D-ALA, and this prevents the cell wall synthesis from forming. Now, vancomycin is used to treat gram-positive bacteria, specifically MRSA, known as methicillin-resistant Staphylococcus aureus. It can also treat streptococcus infection, also bacillus infection, and Colostrum difficile. Now, the main thing that you need to know for the Nclex is that vancomycin is mostly used to treat MRSA and C. diff. Usually, MRSA comes out a lot in the Nclex, and basically the drug of choice for MRSA is vancomycin. Now, the thing that you need to consider is that you need to first do a cultural to determine that it is a gram-positive bacteria so that vancomycin can be used. So it's a for sure thing. Now, as I mentioned before, vancomycin is usually given through the IV because it has reduced intestinal absorption. However, for Colostrum difficile, it can be given PO because usually the bacteria is in the stomach, and since it has reduced intestinal absorption, it is good for the drug to stay there so that it can help fight out the infection in the stomach. So the thing to look out for vancomycin is that this medication is excreted out through the kidney. So you have to check their creatinine level and their BUN. Vancomycin can also damage the kidneys. It's a nephrotoxic medication. So that's another reason why to check their creatinine level and their BUN. Vancomycin can cause ototoxicity, affects the cranial nerve number 8 with their hearing. And the most common adverse reaction that's actually in Nclex, it's an adverse reaction called red man syndrome. So this is caused by a systemic histamine relief, and this is commonly seen in the Nclex. And the common cause of red man syndrome for patients that are taking the IV vancomycin is because the IV is given frequently. So the consideration, or the nursing consideration that you need to look out for, is that you need to give the IV slowly, particularly infuse IV over 60 minutes slowly. The treatment for this is that we would give antihistamine. And another severe adverse reaction of vancomycin is a condition called toxic epidermal necrosis. This is also known as Stevens-Johnson syndrome. This is a rare case where the skin starts to have an allergic reaction towards the medication, and their skin starts to peel off blisters like it's burning. So the treatment for this is that they would usually give early steroids and some IV immunoglobulin. So this is very rare, this condition happens, but the main thing that the Nclex is going to look out for the adverse reaction is red man syndrome. And basically what you need to know is that you need to infuse IV slowly to prevent the red man syndrome, and the treatment is antihistamine. Now let's talk about nursing consideration. We actually discussed some of these PowerPoints or these bullet points in the previous slide. But basically, the one thing that you need to look out for is that you need to monitor renal functions and hearing. This is an Nclex alert. This will commonly come out in the Nclex. So this is very important to remember. Vancomycin is a nephrotoxicity and ototoxicity medication. So remember that. Also remember your cranial nerves. This is cranial nerve number 8 for the hearing. Check for BUN and creatinine level for the renal function. Now, for the adverse reaction, red man syndrome, remember the treatment for this is antihistamine. Monitor for signs of hypersensitivity reaction and anaphylaxis, including pulmonary symptoms, tightness in the throat and chest, squeezing, cough, and dyspnea. And infuse IV over 60 minutes to prevent red man syndrome. Again, with this red man syndrome. Give around the clock to maintain a consistent therapeutic level. So let's practice. A client with MRSA bacterium has been receiving IV vancomycin for the last 3 days. Which test is most important for the nurse to review when preparing to administer this medication? So pause the video and see that you can answer this. So the correct answer is obviously creatinine level. Remember, vancomycin is a nephrotoxicity medication, so you need to determine their creatinine level because that determines if their kidney is functioning properly. That's it for this video, guys. I hope you guys enjoyed the review. Please, again, like and subscribe to our channel. And until next time, we'll see you in the next video. Thank you so much.